All right. What's going on, everyone? Every dentist and dental practices out there, this is for you. I'm Eric Chong, and I'm the CEO of UpgradeMyPractice.com. We own a portfolio of dental practices and work with dental practices that earn at least $3 million a year, and we help them scale and exit in 3 to 5 years so they don't ever have to worry about working or making money from their practice ever again. The reason for this training is for anyone less than $3 million per year is to help them get there so we can potentially work together. All right, so let's get right into it. This is where it all starts. If you don't already know this concept, or if you haven't met me before, there's this one thing. I've worked with hundreds of dentists all across the nation, and the last 4 years, I've been in dental for the last 6 or 7, so I'm sure there's dentist or dental teams out there that have been in dental for a lot longer than I have. But I've been very fortunate to work with some dentists, some GPs, and some surgeons out there that are really top of class, the top, let's say, 1% of the nation. And there's something that I found out about this top 1% that they're doing that the other 99% aren't doing. So I want to share with you this one thing that's holding 99% of dental practices back from about half of their revenue or their patients. I know that might sound like a large number. It might almost seem like it's not even possible. Like, how could you be missing half of the money that you have worked for just and never received, right? It sounds like a concept that's almost embarrassing, but that's okay because it's not embarrassing. There's dentists that have been doing this for 45 years and never done it. And 99% of dental offices just are not doing this because this isn't a clinical thing. This isn't a dental thing. And this isn't really a medical thing either. It has a little bit to do with the administration side and a lot more to do with just the fundamentals of your practice and doing it well. And you'll see why that quote, when they say fundamentals aren't everything, they are the only thing. And I love that quote by Michael Jordan because it's going to apply to exactly what we're talking about here today. So what we're going to cover in this video, in this presentation, is the introduction to this whole concept. I mean, what is this one missing thing? How important is it? Why do I need to know it? You know, why does 99% of practices miss this one thing at all? And what is the one question that dentists should be asking in relation to, you know, their duty or their job? And I'm going to show you some evidence of payment here because, especially in this internet world and with AI, I will show you photos that aren't fabricated. This is real proof, and you will see the evidence of that there. And the best part about this is you'll see there's no clinical changes required. So as a dentist or as a dental practice, you don't need to change what you're doing with the patients. But this will be the biggest opportunity for dentists to get paid. You'll see in this that if you could get paid for the doctor portion of the work that you do, it's the most valuable piece of the work that you're already doing, but in most cases probably not getting paid for. And this is going to be a game changer, you know, for your entire practice. Not the way you do your clinical skills, but the way you are able to accept and say yes to, or the way the patients are able to say yes to your treatment. So it really is the biggest missing piece. Now, I'm going to start with words that my business partner told me, and don't be alarmed or surprised. If you're in dental or you're in dentistry, don't worry, your job's not going anywhere. I want to first say that because I don't want to scare anybody in this presentation, but dentistry is dead. And the more I work with dentists and help dental patients, I realize how true that is. And what I mean by that is here in the US, we use the word dental, the 6-letter word, right? That begins with D and ends with L. We use it as a reason and an excuse not to cover the most important part of our body, which is our mouth. So what I want to say is oral health care or oral health is the future. And that's what we're seeing here today. And this isn't just some presentation that you're going to watch. This is the one simple thing that made the difference in my business partner's dental practice. And at the time, the dental practice was doing $1.3 million. With all of the marketing and being as competitive as they could be, they couldn't quite get over that 1.3 number, which for most dental practices is doing quite well. But they still weren't reaching the numbers that they knew they could reach. And it was just making this one shift, this one change that allowed them to make $3.3 million while seeing less patients, working less days a week, and living a much stress-free and enjoyable, work environment. So before we get into the one thing, just as you probably already know, dental demand is higher than ever. If the last 3 years hasn't been the best 3 years of your dental practice, there's a problem and we need to fix that. Even while all these dental practices were closed, our dental practices were paid to stay open. Some of them received a letter, some of them received a check. But the important thing is unlike dentistry and the ADA that told all the dental offices shut down, the federal government reminded and even paid our dental offices to stay open. So what was the difference between the 99% of dental offices that were asked to shut down and the 1% of dental offices that were paid to stay open? The difference, it may sound so simple when I say it, but you'll see why this makes sense. It's just about being a doctor and not just a dentist. It's about receiving the most valuable part of your pay. And when you're recognized as a doctor, not only do you get the pay, you get the patients, and you get listed on a government website federally. So there's proven techniques to do this. This isn't just something that we created overnight. It's something that we've built over 4 years of servicing clients. But before that, we did it for our practice, and we learned from a mentor and a dentist that was doing this for almost a decade before us. So this is a proven technique based on proven strategies that we know that work and are time tested. This isn't based off of some course or some material that we made up or we, watched over the weekend. This is something that we did. We lived, eat, and breathed in our practice, and we helped other practices do. I think that's what makes us unique. We're one of the few services out there that owned and operated dental practices first, and we're doing that again now. So what we've done is we created the software to make it simple for us first. And before we get into this presentation, I just want you to know that there's 36,000 new patients every day. And the most important thing to get access to this and to tap into these 36,000 new patients is to register and get your P10 number, your provider transaction access number. And that's what it is. This is the one thing that is holding you back from going from 1.3 million to 3.3 million, for example, and what happened to this practice. And it can happen for yours too. The best thing about this is, unlike marketing or unlike even a clinical skills course that you take, this isn't an if or a maybe. This isn't if you receive a patient that needs your help or if you have a patient that needs your treatment. This is something that when you understand this works every single time. So before we get into the presentation, I just want to read a quick disclaimer. This information is provided by upgrademypractice.com and is informational and educational purposes only. We are not Medicare or any payer, and we make no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, suitability, or availability concerning the information, products, services, or related graphics contained herein. We are not lawyers, doctors, or financial accountants. Please consult legal, medical, and or financial advice before making any changes to your practice and or patient care. This information should not in any way change the way you diagnose and or bill your procedures. Make your own judgment as a physician and provider for your work with your patients. All right, so let's get right into it. You're a dentist, or if you're on this presentation, you're probably working with one, married to one, or related to one in some way. So the biggest question that I think every dentist should be asking, and probably did ask at one point, but didn't find the answer to, is this. We all know the definition, and I don't need to preach to the choir here, but I have a very important point, and you'll see what I mean. So everybody knows that the dentist, the definition is a person qualified to treat the diseases and conditions that affect the teeth and the gums. And then it goes on to say, especially the repair and extraction of teeth and the insertion of artificial ones. So the reason why I bring up the definition first is we know what the definition is. We know what the role of a dentist is. However, most dentists, 99% of them, are doing dental insurance only, or they may have made the shift out of it and are taking cash. But the question I want to ask is, why are we limiting ourselves? Why are we cutting our arms and legs off? And what I mean is, if a dentist is a person qualified to treat the diseases and conditions that affect the teeth and the gums, what are the ADA codes, or what are the items on your menu, or what is your fee schedule that you use to get paid for the first line of your job, or the most important part, the most valuable part of the work that you do? And for 99% of the dentists and dental practices out there that I meet, the answer to that question is, unfortunately and sadly, it's no. There is no answer. So that's a very important and very huge problem. That would be like a mechanic not getting paid on any of the work that he did on a car. We need to change that. So when this happens, you can get checks from Medicare and from all of the other payers, because you may have heard the rumors, but I'm here to set them straight. Medicare and medical billing is and should be done by dentists, because dentists are doctors of the mouth. Unless if you're only working on cadavers and pig heads, you should get paid for the most important and valuable part of the work that you do, right? And last time I checked, Delta Dental isn't sending you checks like this. But as a doctor, if you're doing surgery, especially if you're helping patients get healthier with the medical part of their medical portion of your treatment, then you absolutely should get paid and reimbursed, so you don't have to cut corners and you can provide the standard of care. So I just want to provide some evidence and proof that there are doctors that are getting paid checks like this. And we'll get into more detail on exactly how to do it and what this means for your practice. But I just want to show you right now the evidence and share with you that it is possible, that there are other dentists that are getting paid day in, day out by Medicare and other medical insurances for the most important part of the work that they're doing. Everyone's doing it as a dentist. GP or specialist, doesn't matter. Okay, so if you're wondering what this looks like inside your dental practice or what the reimbursement looks like, this is the EOB, or the receipt, right? Explanation of benefits that you receive from any medical claims that you do. And this is the doctor portion of the work that you've probably already been doing, but just haven't been getting paid for. So I know not all dentists are doing surgery, but especially if you are doing surgery, listen up, because these are the examples that would apply directly to what you do. So when you have a patient visit and you're doing it for medical reasons, you can claim for a bone graft and excision that comes out to $4,668.35. This one was on the maxilla. When it's on the mandible, it pays a little bit more, as you can see. And this is a case where we even build the evaluation, incision, drainage of abscess, and osteoplasty. And it came out to just over $9,000 for one patient visit and one claim. So we do this regularly for dentists, and we help them get paid for the doctor portion of the work that they do, and we want to help you do it also. So you have about a 12-month window to go back to bill for procedures that you've already done. So this isn't just moving forward. I mean, although I highly recommend that you do this moving forward. If you're watching this video now, that's what this is for. It's to bring awareness to you and let you know that this is possible. I mean, when I first started working with dentists, I know that there's a lot of secrets, but I don't really believe in that. I think that we should do the best that we can to share our information, to collaborate, because medical collaboration is coming. And so if you haven't heard of Medicare or medical billing already for dentistry, you should, because that is the one thing, and I'm showing you a check here that could have your name on it, because especially if you're seeing live patients, if you're doing any kind of surgery, you should look into the difference that Medicare and medical billing could do. I mean, this works for all types of practices, by the way, any kind of GP practice, even. You don't have to be a specialty practice, but it works especially well if you're doing a lot of surgery. So what kind of patients is this good for? And is this like finding a needle in a haystack, or is there a lot of them? I mean, I asked the same questions when I first got involved. I thought that this would be something that you'd have to really sift for and sort through. But I was surprised to know that especially when it comes to 65 and older category, that 9 out of 10 patients I found in not just my practices, but the practices that we've been working with, that about 9 out of 10 have some medical need or health reason that they need the work done in the first place. And so the first question I would ask is if they qualify. And then the second question that we probably don't ask enough and would really protect our practice is, are we doing something in our practice to deny dental? And of course, we're not actively looking to deny anybody dental treatment. We're always looking to accept or get as many patients to accept treatment as possible. But there's 9 out of 10 patients that absolutely need your treatment as a dentist, especially in the 65 and older category, but you're not closing, or you're not getting 90% of your cases to be accepted. There's probably something that you're doing to deny dental to these patients without even realizing it. And the biggest thing that we find is financial, right? They may love you as a dentist, but if they cannot afford it, or behind in the back of their mind, they're like, why am I overpaying or paying double for something that my health plan should cover? Regardless of whether they can verbalize it or not, they're thinking the same thing, right? And nobody likes to pay more or double for something. So now that you know exactly how a person or as a dentist, you get paid for treating the diseases and the conditions that affect the teeth and the gums, you understand the importance of medical billing. So Dr. Smith, I just want to share, he did full arch implant placement and hybrid prosthetics since 1988. And these are his words. He says, yes, I've tried and I learned it the hard way. After 3 years, I've learned it was impossible to do medical billing without a biller and coder. There are no other ways. And when I met this team, I realized who you know can make a huge difference in your success. I recommend the Streamline system for dentists, something I have not seen in 45 years of dentistry. The reason why I wanted to share this with you is because there's a lot of things that dentists can see or research about medical billing, but just like having a dental license is required to practice dentistry, when you're doing medical billing and coding, it's something that you just want to make sure that you're doing it the right way. You have to have the license for it as well. So don't deal with anybody that's just been to a class. It might be okay for dental, but it's definitely not the same thing for medical billing and coding. And that's what Dr. Smith is referring to here. Is he's been through it. He's been through the ups and the downs, and he's even been through federal court cases, both as an expert and learned a lot, just by being asked to be part of these federal level cases where they try to determine what exactly is dental versus medical and what's qualified to be acceptable for treatment. So Dr. Smith was an not just an integral client of ours, but an incredible mentor to learn the right way to do things instead of the risky way and the wrong way, which we found a lot of the courses and a lot of the training material out there, when you Google this stuff, is just teaching things that won't work. It's not designed for a dental practice to do at scale, and it's definitely not designed to keep a dental practice safe. It may work once or twice and you may get paid, but they're not compliant or they're not following the rules, and you have to read between the lines. So I don't want to get too far into that. We have more training on other parts of that in other videos, but the important part for this is just understand that you can get paid and that you're a doctor, not just a dentist. This is the biggest shift, again, that's coming to the US especially. In other countries, they already realize that dental or dentistry is a specialty of medicine, and that dentists are doctors of the mouth. Go figure, right? So what does this mean for your practice, overall? And this is just an example. There's a lot of doctors that we've done. Even bigger numbers and some, not as large. But the important thing is this isn't a promise. I'm not saying that you're going to do exactly this, but imagine getting this from just one payer, right? And this is for this dentist, this was the case. You can see that 99% of dentists really are leaving a lot of money on the table. And this is the most valuable part of the work that they should be getting paid on, but they're just leaving on the table. And mind you, this is just one payer. So we want to help you do just that. To give you an idea of an implant and crown, let's just say that we compare a practice that takes dental insurance only, or they're focused on, like a PPO fee schedule dental insurance, versus like a cash-based practice or a cash-only practice, or what we call fee for schedule. And then let's compare a practice that does medical billing and one that does medical and accepts dental billing, one that does both. So again, this is just estimates, so I'm not trying to say that these aren't exact dollar amounts, but what I see from practices is that the dental only practices are the most limited, because they don't have a fee schedule for the conditions and the infections, or the most valuable part of the work that they're doing. And that's why it really is important for a dental practice to start creating that fee schedule. So it's not about going fee for service or cash only. It's about creating the fee schedule and the menu that best suits your practice and your clinical skills, right? And that's what I see the shift that's happening. And so the dentists that do that know how to fully explain and educate their patients, and they're able to get a higher case acceptance and get the patients to not just pay but want to pay more for the work that they're doing. They should get more money, right? I know it sounds so simple, but that's just what I see from a third party, not just in our practice, but outside of it, looking over the shoulder of the practices that we work with. And then when you add medical billing, this isn't exactly proportional, because some of practice, they add 20 to 30%. Some of them add more. Some of them are doubling their income. But as an example, you can expect medical billing to add a huge increase into the revenue that you're receiving. And the best thing about the medical billing portion is that there's very little overhead, especially for surgery out there, because the surgery component requires very little restorative or labor, right? Additional labor. So it's just an addition, and it's money that you never would have had. And of course, if you do dental and medical, what I love about this scenario is you can get a little bit more in some cases, you can, but it's not just about collecting more. It's about making it easier for case acceptance and less out of pocket for the patient. So in dental and medical, the patient can sometimes not have to pay anything, if at all. So here's the breakdown and how it works out. Of course, other practices, you may make a lot more or less than these numbers. But if you're dental only, you have to get the $1,500 from dental insurance, and then the $2,500 you have to get from the patient, right? And so together you might get 4,000 if you do that. And if you're cash only, some people, I've seen implants that go a lot lower. I've seen even less than 3,000. But let's just say 3 to 5,000 you can get if you are really good at case presentation and you command a higher fee schedule. You can get more. But let's just say 3 to 5,000. But with medical billing, what you'd get is about $4,600. And again, this is just on the maxilla. You get even more on the mandible. But let's just say you get about $4,600 on the low end. And then from the patient portion, they would still pay you your regular, fee schedule. And so let's just say $3,000 for that. And then that would come out to about $7,600 that you'd receive on the overall treatment. And then same thing with dental. When it's dental and medical billing, you would again just receive, instead of the $3,000 directly all from the patient, $1,500 would be covered by dental insurance, and then we would just have the rest be covered by dental insurance. So then again, the total is $7,600. But to be honest, when it's dental and medical billing, the really big advantage here is you're providing more options and choices. The patient feels usually better and has more trust. And so not only can the number be higher than 7,600, you have higher case acceptance, and it's just easier to keep your schedule full with patients that need your help. So what does this look like again in as far as patient acceptance goes? I just did a very rough figure because I know some practices may be doing a lot better or may be doing a lot worse than this. But when you start off, it's good if you can get 1/3 of the people to say yes. I know when I first started off talking to patients, I don't know if I was that good, but let's just say you had 1% or 1/3 saying yes, 1/3 saying no, and 1/3 that are undecided. They want to get a second opinion or shop for other prices. Then fine, that's in a standard case. What I find is this medical billing component makes it that much easier. You'll still get some of the people that do want to shop around, but it may grow in the future. But what I found is as a dental practice doing medical billing, it instantly puts you in the 1%, and it separates you from the competition and those dentists that are not. So what I see is not just because of that reason, but because of the increase in options, and they know usually through this training and through other trainings that they can tell that they're being taken care of, right? It's not just trying to take care of their teeth or the money that they see, but it's really trying to take care of, the practice is trying to take care of the patient. So in that case, the patient feels better and wants to proceed with treatment from a real registered physician, right? Doctor of the mouth. So we see the case acceptance go up a lot, and I'm just throwing a number out there, but we do see our case acceptance go up. Sometimes practices are doing about 30% case acceptance to 40% before seeing our system or using our system, but after they're closing at 60, 70, 80, sometimes higher case acceptance because of our system. It's not unusual to actually get all 9 out of 10 patients that need treatment to accept it. Because once the financial issue is out of the way, or mostly out of the way, the patient portion, really isn't much, if at all. So again, we'll go through the exact details of that. And, of course, if you decide to move forward with this, you'll want to learn exactly how to do it for your practice. But we have all the systems, and we have all the training, and we have example cases that you can look through and learn from to know exactly, how to do it for your practice. For Dr. Mark, when he joined our system, he wasn't concerned about the additional money he was making because this is the time. Well, this was a couple years ago, so the time was unusual, but he also was building his practice, and he wanted to get new patients. So we helped him. We gave him an ad that had worked with our practices with approved language, and he loved it because he liked that it worked, the medical billing. But when he sent this out, he got 11 calls on the first day, and 9 of them turned out to be appointments. And as he says, the best part is all but one of them were Medicare. So I guess there's just a very simple choice for you. And the choice is to decide whether you want to, continue to leave the money on the table. And this is money that you've probably never seen or never received. And it's okay. You can just pretend to forget about this whole presentation and continue to do it the hard way. I mean, you've already done it for however long you've been practicing, whether that be 5, 10, 15, 20, 30, 40 years or longer. So, I mean, you already made do with it and you're already getting by. So who's to say that, you even need the other money, right? You could just sign it over to me, for example. No, I'm just joking, but you can continue to leave the money on the table, or you can claim your money and you can continue, or you can choose to receive it, claim it, and experience what it's like to get paid as a doctor. Or if you're an office manager working at a dental office, you should experience what it's like working at the highest revenue business in the US. By statistic, that's the case. So if you're struggling like I was, because I was working at a front office as well, and I was always calling dental insurance and wondering why I kept on throwing stuff up and there wasn't enough money at the end of the month. If you're in that situation, maybe you should look into this more. So I'm going to kind of close off this presentation with saying this is the largest demand. I mean, everyone's fighting for scraps in the dental industry. I mean, literally the entire dental industry is fighting for like the 30% of patients, but it's not even the patients that have money or the patients that have the demand. The real demand is in these 36,000 new patients every day. It's the largest demand in dental and the largest need. You might have heard of them as the baby boomers, but this is just the beginning. They're scheduled or planned just by population to increase about 10 to 12% per year, but there's a lot of other factors that are going to drive that number up. I mean, we see health as a factor that keeps getting more and more attention, and people know that health starts from the mouth. So they're wanting to go to a dentist and get a good doctor, for their mouth more and more. So that's what this presentation is all about. If you just understand one thing, if anything, it's to get your doctor's pay as a dentist, and that dental is medical. All right, so if you're not already on upgrademypractice.com/learn, I recommend you do so now and bookmark this page, because there's going to be other videos that you can view that will give you more training so you can learn more on how you can get your doctor's pay. We're going to go through the why medical billing, exactly what it is not, and when to do medical billing. You definitely want to watch out for that, but I'll give you a little tip. You only have a 12-month window, and every day that passes by is a day that you can't go back and claim for procedures that you've already done. So again, this is money that's already sitting there, money that you've already worked for. I just want to help you get it. And the how. So you maybe have more questions on how this process works and how you can get started yourself. And of course, case studies, you can find all of that and more on upgrademypractice.com/learn. Make sure you go there now if you're not already there, and you bookmark this page so that way you can save it. Maybe set a reminder for yourself to make sure you go through these videos every morning or every afternoon, however you can, to make sure you understand this and you're not left behind from all the other dental practices and you stay in the top. And if you're not there, this is the best opportunity to learn from that top 1% of dental practices, so that way you can learn what really moves the needle for your practice and what makes the biggest difference for you. So we'll get into this and we'll see you on the other videos.